On to our Health Watch, where we talk about all the topics that are trending in the medical world with Dr. Syed Hussain from Trinity Health of New England. Good to see you again, sir.
Likewise.
Yeah, glad to have you here. All right, so first things first, we want to talk about this new FDA-approved drug to help babies and toddlers fight off RSV, respiratory syncytial virus, something that I think we're talking about more in the media these years, but it's something that people in emergency departments have known about for a long time.
Absolutely, Tim. This couldn't come at a better time, to be honest, because we know what happened last year when we had over 50,000 children hospitalized across the country for RSV. This is the first drug to be approved by the FDA for children. This is for children under the age of 2. It's an injection form. It's basically like an antibody and provides protection against RSV for up to 5 to 6 months per the studies that were conducted. We do expect the CDC to weigh in next month to identify who out of those children should receive this drug first. Okay. It has been approved in other countries, Europe, Canada, so this is a promising step. And one thing I do want to mention to viewers is that Australia, which we really track closely during our summertime, is experiencing one of their worst flu seasons right now. So we need to learn from that, as we always do, and be better prepared.
Yeah, Australia tends to be a good predictor for us because they essentially are in winter when we're in summer and vice versa. Moving on, the American Heart Association said new research shows that vaping can hurt the heart and the lungs, even when nicotine's not present in e-cigarettes. So what kind of effects are they seeing here, and what does this mean for a lot of young people? Yeah,
the American Heart Association released a scientific statement, Tim, which basically says more research is needed, but based on existing data from animal studies as well as humans, that vaping or e-cigarettes with or without nicotine, because of the ingredients that go into making them, can pose risks such as blood pressure issues, heart rate issues, and then even in individuals who've used it more than 2 years or more, they're seeing an uptick in pulmonary disease such as COPD, asthma, emphysema, all of those. So it's important that more research is conducted, but the notion that e-cigarettes may be safer than regular cigarettes is not.
Not looking great.
Exactly.
I feel like a lot of pulmonologists would always say nothing should be going into your lungs at all other than clean, fresh air. According to the CDC, how about this? Older adults who use a hearing aid, they say maybe by using a hearing aid, you could cut your risk of getting dementia maybe in half. This would just be the latest in what seems like all of a sudden a tidal wave of great news, or at least new news when it comes to Alzheimer's disease and other forms of dementia.
Yeah, this is promising because we know as people age more and live longer that we will see an uptick in dementia. So hearing loss is a known risk factor for cognitive decline, which can include impairment all the way to dementia. So take-home message here is for folks, if you do have risk factors, if you're getting up in age, when you go for your annual PCP checkup, make sure you get your hearing checked. Even if there's mild hearing loss, you may benefit from hearing aids, which are easy to get, they're risk-free, and may actually prevent dementia.
Yeah, and it's also worth pointing out, like you just did a second before, a lot of times we talk about Alzheimer's disease and dementia as one and the same, but Alzheimer's disease is just a form of dementia. There's other forms, and this study applies to them as well.
That's right.
Which is even better news, and long story short there. All right, Doctor, thank you so much for the time. Good to see you. As always, we try to get through a lot of news, a lot of good news very, very quickly. So thank you for the time. We do appreciate it.